right, welcome back, Pittsburgh and America. I'm Ellis Cannon, your host once again, as always, here at Night Talk at PCNC. We've got a great show for you. Hopefully you had a great couple of days, a lot to tackle tonight, as always, on the fastest show on television. Class is officially started. Get out the pads, and for that matter, pens. We're going to tell you what the show's going to be about tonight and how and why I tie it together with me. I'm going to tell you a secret about that in just a moment. First, some details on the show. You may see this cable show that is dedicated to hoarding, and for that matter, all things that come with that type of, well, let's say, dilemma. Tonight we're going to be talking about it from a real-life perspective and also a psychiatric, if not psychological one as well. We have a couple of great experts who will be with us for about 3 segments as we tackle what that's all about and why and how it affects a lot of us. It might look just like a television show, and in some respects, of course, it is television, so it's not exactly real, but there are aspects of it that are, and it is a real condition. It is something that perhaps affects both you and I. I'm going to tell you straight up, my hands in the air. No, do I hoard? I don't know, because I don't even know if I know what hoarding is. Do I keep things around too long? Absolutely. Am I in the midst of a move, and am I driving people around me insane because I can't seem to let go? Yeah, that would be your cat right here. So here's the secret. I'm going to tell you something. Particularly we have people on with mental health or psychiatric backgrounds. A lot of times these shows are about me. See, this is how it works. I know that I tell you it's about you, and we're doing this great job where we're telling you or otherwise giving you information that impacts you and for that matter is important to you. Well, that's a lie. See, actually I do it for me. And this is one of those shows that I can tell you I'm doing for me, at least for 3 segments, because I need help. But I look at it this way. If I need help, you probably need help. So we'll have a couple of guests to talk about that tonight. Hey, I love to lift or exercise when I can, and, well, tonight we've got an expert who's, well, resizing, redoing the way a lot of people, particularly as they get older in life, work out. I think it's astonishing, if not interesting. Have you ever thought about working out with a towel? Have you ever thought about working out with a terrible towel? Well, tonight we're going to give you an expert who knows all about that type of thing. And trust me, even with this little towel, even though his nickname as a kid was Zipper, he could kick you all over the street. Now, one last thing, a little bit later, speaking of the street, we've got a new show here at PCNC, and tomorrow night it will debut. The effervescent, lovely, and world-renowned Audrey Gusky. She's a professor in marketing and more over at Duquesne University. She's going to be with us a little bit later to talk about her program and why it's important for you. But right now, I care about my program, the one that's about me. So stay right there. Get ready to go. It's going to be a lot of fun. We'll learn a lot. And as always, we'll zip right through it. I'm Ellis Cannon. Always a pleasure to be in your home. Thanks for the privilege. You're watching all this unfold right here at PCNC. You know, I did my opening based on whatever nonsense was rambling about. I will tell you that I gave some thought to describing this as an easy show. Now, let me explain what I mean. The fact of the matter is tomorrow night we've got a legal hour, and that's about 15 topics or 15 cases. Those are a little bit more involved. But tonight, I ought to be light, lively, and fun. Right off the bat, Vickie Dellaquila is going to be with us, and she is right here. She is to the far left, and she's a professional organizer. She's also the author of a book, Don't Toss My Memories in the Trash, which is penned just for me. And Alicia Kaplan is to my immediate left. She's a doctor and AGH psychiatrist. Ladies, thank you so much for being here. Obviously, I'm pretty excited about the topic, and I'm glad you could make it tonight. Vickie, let's start with you. Okay. Certified Professional Organizer, Institute for Challenging Disorganization. You're a member of that. Yep. Again, I mentioned the book, and organizationrules.com. How does somebody become a certified professional organizer? What is a certified professional organizer?
Well, it's usually an organizer who has been working for a few years with clients and has gained skills through organizing, helping them with various things to simplify their life. And through our national organization, NAPO, the National Association of Professional Organizers, we started the certification process about 3 years ago. We take testing, we get CEUs, and we keep updating our skills in the professional organizing business.
That's good enough. You're hired. When can you come to work? All right. I know you were part of the inaugural class in 2007, right, and obviously emerged from that with a lot of background academically. I see that you've been at tons of different seminars and, things of that sort, and you've developed a business associated with this. Now, as I mentioned a moment ago, before we get to the psychiatric aspect of this, from a real-life perspective, can you give us a sense of how many people, for instance, or some range, percentage-wise, some type of sense of who is affected by this or who needs the help of a CPO?
Well, with an issue to hoarding, which is certainly a much deeper level of disorganization, I get quite a few calls from family, occasionally the person themselves, of different socioeconomic classes, different educational levels, who have very many problems in their life because of the disorganization, have trouble living their life in their home because of it.
And I know the disorganization is obviously very clearly a part of everything that you work with in terms of clients and so forth. In the broader sense, hoarding is just one aspect of all of this. Talk about it, though, from a psychiatric standpoint, whether it's as broad as you need better organization, or maybe a little bit more specific into something we would diagnose as hoarding. What exactly is that?
Well, hoarding was initially thought to be a subtype of obsessive-compulsive disorder. Now it's looking like it may be, in fact, a separate entity, a separate condition, the way that we classify it per psychiatry. What it consists of is problems, not only problems with excessive saving, collecting, but problems with throwing things out. People develop a strong emotional attachment to their items and have a lot of distress when others try to help them throw things away. So it's a level of disorganization, also problems with information processing, with attention into making decisions as to what to throw out and what to keep.
Now, whether we're talking about something called hoarding or disorganization or any number of other aspects, I know that you talk about downsizing, organizing, doing it in an efficient and organized manner. I know that your book involves and focuses on seniors to a certain extent. When we do talk about a show like I just referenced, does that heighten the awareness of this, or does it create, in some respects, even more business or even more attention to people that have this disorder, if you will?
I think the shows have done a really great service in attracting the awareness of the situation, because I think a lot of people didn't know. They thought they were the only person who had this type of disorder with chronic disorganization or hoarding, and then they seek treatment. And so the shows have done a really good service, I think, to most people.
I have to tell you, I got up in the middle of the night, and I got up in the middle of the night when I didn't want to. And I knew that you ladies were going to be on the show, and sure enough, I'm going through, and it's 1 o'clock, 2 o'clock, bam! I find this show, and all of a sudden I'm watching people, and I'm terrified. I'm thinking to myself, there's something wrong here. Now, forgive me, I'm saying that as a lay person. I'm not saying it judgmentally, because I got a lot of flaws. But the fact of the matter is, when you do see it, it sort of screams out at you like, oh man, you've got an issue here. Is that fair? You're nodding.
Yeah, I mean, a lot of these patients, unfortunately, have what we call poor insight into the problem. They don't see it as much as a problem as other people see it. They don't see that there's disastrous situations in the home and unsafety. They don't see it with the same eyes that other people see it.
And sure enough, when it's through the lens of a camera and it's all over the world, it's real easy to look at the sidelines and from the sidelines and say, man, that's all messed up. On the other hand, you have, like anybody else that has a disorder, you have to have some empathy, if not sympathy, for them. When you focus, for instance, and we'll talk about the book a little bit later as well, and I know it was one of the top 100 books on Amazon for seniors or on aging, I see a lot of your work is dedicated, in fact, for people, as you point out, you spend the first half of your life collecting, the second half of your life throwing everything out. How much more difficult is that as we get older? I assume it gets much more difficult.
I think it's very hard from an emotional end, because, you know, so many things have so many memories attached to them, so it's very hard to let go. But I work with people to try to get them to think about, you know, maybe this could leave your life now, because you need to have less in your life, you're ready to move on, and maybe you can let it go. Okay,
both of you can answer this. When I'm going through this personal move, and I'm going to highlight and use as a case example after the break, I will tell you that I have buddies say to me, man, let it go. You'll feel so much better when you let some of this stuff go. And I'll be more specific in a moment. But that there's a sense of relief, if not, I guess, lightening of the load to walk across that line. Is that a fair way to put it?
I mean, people that have true compulsive hoarding, they have a lot of distress with letting their things go. They don't feel that kind of relief at all. They feel,
wow.
Because sometimes they see themselves in their things, whether it's because of a memory they have from a loved one, or they, for some reason, we don't know exactly why. It may be a neurobiological problem, but they have more sense of a personal connection to their items, more responsibility than another person would. So when if someone was to just take their things away, they feel grief over that loss, almost like a person, even though it's an inanimate object.
That's pretty heavy. And that's not exactly what I anticipated when I asked the question. That's why we do live television. I mean, you heard how I asked the question. I framed it like it'll be a relief. What are your thoughts?
Well, no, in the hoarding world, it is not a relief. It is very difficult to have a client let go of items. We work with them for a long time because we have to develop a trusted relationship, because it's all about trust and letting us into their private space in their home to help them through this, to help them become safe and live in their home again. And it is a very difficult process for them to let go of it.
Okay, I'm going to trust Vickie when I come back, and for that matter, all of you, I'm going to give you my ideas on how this affects me. And for that matter, I learned a word tonight I never heard of: decluttering. That's right, decluttering in you. We'll talk about that. 2 more segments with our experts on this disorder. We'll start that in 2 minutes at PCNC. All right, welcome back to PCNC. I'm Ellis Cannon. You're watching us at Night Talk. All right, we're talking to Vickie and Alicia about disorganization, decluttering, and more. Alicia, to my immediate left, she would be the one with, well, let's say I'm now going to go into fashion. The cream-colored blouse. Is that okay? Does that work? Sort of. Yeah, right. Okay, and then of course we have Vickie Dellaquila as well. Now, Vickie, I want to get into my case study.
Okay.
We are moving an office we've had for 9, almost 10 years. Through the course of that, as I've reviewed it, meaning the materials that I kept, which cover about 15 years, I'm of the mind I'm looking at several lives, literally several different lives. Now, my careers have been multiple, so it's not difficult for me to say that. It's the absolute truth. But looking at it, one of the big areas, and you guys hit it early, that is difficult for me when I go to throw things away. Forget about heirlooms and my dad's stuff and all that. What's difficult for me is this stuff represents my work. This is my time in it. This is my preparation. I'm not going to do the same show I did 10 years ago, but I probably still have those notes. I mean, the fact is that I have it because it's mine. It's my work. It would be like asking an artist to throw his stuff out.
Sure.
And that's very difficult for me to do. Am I strange or what?
No, you're not strange at all. And you know what? You may need just to box it and keep it.
Well, we've been doing that. But no, I kicked it down the road 2 or 3 times, and now I have thrown a lot of things out, more than ever. And there are some other steps that need to be taken. And I know organization is critical. It's the only way I can do the different things that I do. But isn't it more difficult when it is your own work?
It is. It's very difficult. What I see a lot of people do in that type of thing, like you just said, an artist yourself, is they have to revisit it a few times and then think, well, maybe I could let parts of this go and just keep just certain parts of it. And then maybe a little bit down the road you can let go of a little bit more. And maybe you can't. Maybe you're going to need just to box it and just call it, this is my work. And it's just going to have to come with you.
Well, that's interesting, because there are parts of it that I look at, Alicia, and I do say to myself that I have to go through different rounds of this. When I first started it, it was, okay, I'll throw it a little bit, then a little bit. And I need to go through it 3 or 4 times to almost relive it for whatever it's worth, and then it is a little bit easier. But this is not an easy condition. Talk a little bit about why that's the case and how it's become more complicated.
Well, there's all degrees of hoarding, okay? For more severe hoarding that gets worse as they get older, they often have not only the hoarding problem, but coexistent mood and anxiety disorders. At least 50% of those patients with severe hoarding have either major depression or another anxiety disorder, most commonly major depressive disorder. So it's very important that those patients get in for treatment, because if you treat the major depressive disorder with an antidepressant, that will often help the motivation, the energy, the focusing, and increase mood in that patient, so they might be more organized.
You know what I'm thinking about here, and I don't mind just telling you what's running through my head. That's how I do this show. I'm thinking to myself, we, and I think a lot of people out there, have come to use that term hoarding, or for that matter, phrase is similar, because we see it on TV, and we see a guy that, has 600, forks in his house, and whatever. And we're probably doing a miscarriage of justice, if not a diagnosis, by just calling it that way as lay people. You're talking about really deep stuff. I mean, I think you've mentioned there's medication for this as well. And I'm thinking, wait a minute, all I'm talking about is a guy with 600 forks here. But this is something that is a lot more deep than that.
Yeah, for clinically significant hoarding, which we call compulsive hoarding, which, like I said before, it had been thought of as an part of obsessive compulsive disorder. There is treatment. Now, it tends to be harder to treat than general obsessive compulsive disorder with medications. Nevertheless, as part of a treatment regimen, medication, a type of therapy called cognitive behavioral therapy, and professional organizers can help with that combination in treating the complex compulsive hoarder. For example, medications have been looked at in studies, certain antidepressants that can make a difference for some patients.
But I got to ask you a question, Alicia. And you're Miss Outside, you're Miss Inside. You go in the house, you're like the people we see on TV who go boom, boom, boom. You're like the nanny. And then you're on the outside and you're trying to fix them up medically. What are they getting? What does the medication do? Now, I'm talking in broad strokes. I recognize that. Is it in addressing the anxiety? Is it addressing that feeling of guilt that you told us about? I mean, it's not like you're giving a medication so they hear voices, throw away the forks. I mean, what is it that the medication generally looks to treat when we start talking about this?
Well, again, I think that it is a challenging, harder condition to treat with medication, but sometimes the medication can help with underlying depression, okay, with the anxiety, and even the saving and hoarding compulsions. It can help with all that.
All right, okay. Let's go back out to you. You're on the inside. Tell me what it's like to go into one of these houses.
Usually when I get the call, it's usually from a family member, and it's a very hard call for the family member to make.
Like an intervention.
Yes, it is. Many times like an intervention. Sometimes the person could be facing things like eviction, so they need to take care of their home. The person will let me in, usually with a family member. They're usually very ashamed of their situation. They're usually very articulate, intelligent people that are just so scared and they don't know what to do. So it's all about gaining trust and starting to work with them, developing a plan on going through their things to help let go of some things.
Now, I've read your material. I printed them all over the weekend, and I looked at them a couple different times, and I came up with this word decluttering. That almost sounds light to me, light as in L-I-T-E, because it sounds to me like there's bags of garbage that has to get thrown away before we start to declutter, if you know what I mean. Clutter's one thing,
right?
But having a condition that goes this deep strikes me as being a lot more aggressive, a lot worse. Is that right? Yes,
it is. We use actually in the professional organizing industry what we call the clutter hoarding scale, which is different levels 1 through 5, to assess the client where they are. 5 being the highest, where doorways might be blocked, where there might be the kitchen isn't accessible, the water might be turned off. Where level 1 isn't, of course, nearly as severe, there might be some animal hoarding. So that helps us address the situation, and so we need to work, of course, on safety first, so the person can live safe in their house.
I never thought of it that way. Actually, I did about 2 seconds ago, and that would be this. When we see news reports of people that got 75 cats in the house, is this possibly along that same strain?
Yes, animal hoarding. Yes.
All right. Okay, I got to end that. When I come back, I'm going to actually go in the home. I want to go in the home with her. I want to go through the process, what it's like to have a consultation, success, failure, what dictates all of that. One more segment. This is astonishing, if not interesting to me. Stick around. 2 minutes, PCNC. Hoarding comes in a lot of different fashions. We're talking about them tonight, and we've been enjoying them with Vickie Dellaquila. She is a professional organizer, and she's outstanding. We're enjoying our time with her. And also, Alicia Kaplan, just as outstanding. She's a psychiatrist at AGH. We've got some local resources we're going to identify along these lines as well. And a little bit later, John Carleo is with us. He's a fitness expert. Maybe he's got a thought. All right, let's get to you, Vickie. I mentioned about getting in the house and your book, which we talked about earlier, Don't Toss My Memories in the Trash. Your website, organizationrules.com. So you get the phone call, you get the cry for help, you step in. How do you develop the trust? You've used the word trust twice in our conversation. How does that come about?
The first thing is just talking to them about how did they get to where they are now? What has happened throughout their life? and a lot of times it's decades of collections, and sometimes a significant event can really exacerbate the situation, such as the death of a loved one, divorce, job loss. So how did you get there? And taking a view of the home, and if they'll let me, which most people will, sometimes they won't let me see the whole home, and start to develop a plan of where we could start working with the client to help them go through their things.
But with any, let's say it's an addiction. Let's just talk in those terms. And again, I'm talking as a lay person.
Sure.
That means something much more technical to you too. But generally speaking, you have an addiction. Somebody calls, you call, you're my sister, and you call for me to get help. A lot of times there's a tremendous pushback, is there not? Get out of here. Wait, I got this. I don't need your help.
That's right.
Do you get faced with that?
I get faced with that a lot, and unfortunately, there's not much I can do. I just offer some suggestions on what the family member could do. Maybe try to see a therapist, a psychiatrist. If it is hoarding, try to visit some websites, some different books that might be able to help with the situation. I'm here. You can call me again, and I get that a lot. I'll get people that called me a couple years ago and maybe call me again.
Do you find that this is something that we ultimately see as triggered by something specific in an acute way, or is this generally a condition that develops over time? We see the cumulative effect by the time we get to the 600 forks.
Well, the onset of it usually is in adolescence, and then it tends to get worse over the years, so that's why around age 50 or so, people usually present for treatment, or a family member will notice how bad things are, okay? But certainly in times of stress, like the loss of a loved one, or a break-in, severe trauma like that can cause an acute exacerbation.
Okay, I can understand why it triggers something even much worse. When you go into a house, or for that matter, you set up a program, and you now have broken down those walls, if not literally, and you're in a position where, as with me, you said, okay, that's not necessarily that bad. We can work with that, which is in effect what you did in our conversation when I brought up my problem. What type of standards do you use? I looked at your website, and you have things like, do you need it? Do you use it? Do you have literally objective standards that you have people go through, check off, and to try to put themselves in a position where they can objectively see it's okay to let go?
That's what we do. We work with them on the things, whatever it is, trying to, usually a lot of times we'll put things together in a group. For example, dolls, do you really need 100 dolls? Maybe we could...
I saw a show last night. In the middle of the night, somebody had like 500 dolls in the house, maybe 1,000. I mean, that would freak me out if I walked in and saw that.
Yeah.
But that's just me. But go ahead.
Yeah, and then just starting to think about, maybe some of these dolls could go. They start thinking about, why do you really need to keep them? And, they start rationalizing as to why they might need to keep them. But over time, usually they're able to let go of a few things and let them move on. But start to work with that way. It takes time. It's nothing that just happens overnight. It does take time.
Well, speaking of overnight, and speaking of adolescence, I know in researching your background, not that I stalked you, but I noticed that this is something you did since you were a little child. That when you would go through, you would like to organize boxes of stuff.
Yes.
So this is something, I don't want to say it's a mirror, but it's something that's just the opposite. You've had a passion about this your whole life.
Yes, I have. I was always an organized child. And,
okay. Okay. I got the contract sitting over there. I need you to sign that. Now, one last thing. How about resources? Here in Pittsburgh, obviously, we're being seen regionally, but as you mentioned to me during the break, there's help for people. There's assistance for people, and there's reasons for them to go get it. Talk about where they could go. Well,
the local chapter of the Obsessive Compulsive Foundation has a list on their website of treatment providers that specialize in hoarding. So that's one place to start. Sure. And patients can also talk to their doctor, their primary care doctor, about a referral for therapy or psychiatrist as well.
Okay, good enough. ICD and other places. Okay, Vickie, Alicia, I really enjoyed it. Thanks so much for sharing and putting a light on it and taking something that, again, we may trivialize or, for that matter, maybe treat insensitively and give us a better idea what's up. Appreciate it.
Thank you.
All right.
Thank you.
We're going to come back in just a moment. We're going to be joined by our friend John Carleo. He's Tarzan. I'll explain all this in 2 minutes. You need to be here at PCNC.